Ladies and gentlemen, welcome to the Youth Cafe podcast, where we empower, connect and amplify the voices of the youth. And today we are here to culminate the Immunization Week 2025 in style. Today it's fire on fire. You're not even ready. We're going to discuss on the importance of vaccines, challenges like stockouts, and how we can strengthen immunization here in Kenya. And today we have experts and elites who are here to join us to discuss about the same. Karibuni sana. Please introduce yourself, tell us who you are, where you come from, and any other thing you'd like us to know about you.
Okay, I am David Wedava Baka. I am the Communications and Media Officer at Health NGOs network, that's HENET. Where I come from South Sea, and I'm looking forward to this engagement. We have a lot of information that we are looking forward to discussing in this particular session. So yes, I'm looking forward to the engagement.
Thank you. My name is Catherine Muendo. I'm from Mwala sub-county, that is from Kanki, Chawango. I'm a young mother, of course. I'm here to discuss or to talk about some of the challenges that I faced as a young mother. Yeah.
So hi everyone. It's a pleasure being here. Thank you, Shirley and Team Youth Cafe hosting us. My name is Mercy Wanjiko, and I work with an organization called Ambassador for Youth and Adolescent Reproductive Health Program. We work basically with and for the youth. And I'm glad to be here because I'm going to give my lived experiences as a person who works with the youth, as a person who is a youth. So I believe it's going to be a very impactful conversation. Oh, and you asked us, nimetoka Eastlands, where stars are made,
Yes.
Okay. Yeah.
Now, before we get into serious things, I'd like to ask you a very simple question. If you could create a vaccine for only one thing, what would you vaccinate the world against? It could be something simple like traffic, slow Wi-Fi, diseases, a calamity. And before you give the answer, there's this Kenyan joke that gets me all the time. You could be scrolling on TikTok and then you get this couple that have a significant age difference. Let's say the Chile, or aka the girl, is 20 years and the guy is around 65. And then in the comment section, you'll find people saying, this man is so young. Ata Navel hasn't even healed. He hasn't even gotten the the polio vaccine. Okay, it even slaps more in Swahili because they say, in DJ Shiti's voice, usi ni kijana mdogo, hata amepona kitabu kweli, na chanjo ya polio hata amepata, you see. So now you can give us your answers. Let's start with David.
Mine is simple. Mine is hunger. Yes, it's still the biggest challenge and the biggest threat to life and a decent life. So hunger. Yes.
Some of the calamities like drought. Yeah.
Serious. So I think I would, if there could be a vaccine against poverty, because I think that is what affects everyone. Poverty carries everything.
Yeah.
So, and unfortunately there cannot be a vaccine against poverty. So I think if there could be a vaccine against poverty, that will be amazing, because there are a lot of things. But then on a serious note, if I could advocate for something, it's just a poverty on and a vaccine on HIV cure, because HIV is something that a lot of young people are living with. So if we could get a cure, and a lot of communities, and the drug burden that comes with it and everything, if we could get a cure towards that, a vaccine specifically that is a HIV cure vaccine, that would be amazing.
Now let's get to serious things kidogo. I'll start with Catherine. Could you please share your experience as a young mother from the antenatal care visits? Let's start from being given the purple book. Is it still purple?
Yeah.
Okay, from being given the purple book all the way to delivery and up to now.
So we
started on a high note.
kwanza hey. Unajua kuogopa. You know what is fear? Fear. So the first thing, I attended clinic when I was 4 months pregnant. Yes, when I was 4 months. You know, unajua kwa msichana mara ya kwanza unaogopa. You know? So nikaenda OC, niko hapo daktari nikaelezea 1 2 3 you know, kana kitabu kaletwa. So unajua vile watu wanasema uko na maswali mengi wewe, kwa ni hapa ni clinic. Obviously they are there. They are there, the questions are there. So yeah, the doctors were so nice to me, you know. Kila kitu ikajazwa. Then obvious kuna vitu nafaa upimwe. Naona, so kaenda nikapimwa kila kitu, and then after that mambo ya scan nini. Then after that nikamwambia niende nyumbani sasa nikuandikiwa tu tarehe za kukuja clinic, you know. So I went home. Alafu hey, mimi na kukunya dawa ujinaenda hivi, ngine ndaenda hivyo. So you know, when you are pregnant, it's advisable to take the IFAS, you know. So you know, when you are pregnant, kuna vile unajua the body changes, you know. So nikimeza nasikia unajua rust, you know, rust. Ukimeza unasikia ni kama ni rust, sijui ni nini, then unatapika, you know. So I was given, and then you know it is advisable to take them. So I had to, you know, I had to, even though some of the times when I take them natapika, but then nilijikaza, unaona. So nilijikaza kwa sababu ya mtoto, unaona, kwa sababu ya mtoto. So yeah, nikaenda the following clinic, nikaenda the baby was checked. The baby was checked, that is a through scan, everything was okay. Then tarehe zenye nilikuwa the dates nilikuwa nimeandikiwa kwa clinic, maybe I'm very fast. Date ya kujifungua ilikuwa imeandikwa date 3. That is June. So you know, I was asleep kitu saa, that is 31st May, kitu saa 5 hivi. Nilikuwa na my sister-in-law. So tukapo tumelala, tunapiga story kidogo. Nasikia, what is that? I'm like, what is that? Kama ni maji, kama si maji. So nika-ignore, tukaendelea story kidogo. Nikamwambia, are you serious? Can you get out of your bed? Katoka kusimama, maji. And remember tuko nyumbani, you know. So even though tuko tushajipanga, no, kupack nguo nini, ile pesa whatever. So kutoka na saa hizo unapigia mtu wa pikipiki. Kwetu saa hiyo huwezi pata gari. So what we did, tukaita mtu wa pikipiki, tukapanda. And for that time sikuwa nasikia uchungu. Yeah, I was like watu wanasemanga kujifungua na uchungu. So where is that pain? Where is that pain? So tukaenda. So on our way, that is when I started feeling some pain, that is back pain, you know. Tukaenda hospitali, tukafika, that is Kademesha hospital. dilation pistol. I went to Mwala level 4. So tukaingia, the doctors were there. Akaniambia, hebu tuingie pale. Tuingia hapo kwa hiyo room naona iko hapo. Tukaingia, so you know the stuff they do. Napimwa njia hiyo. Akaniambia, you are 5 centimeters. Nikaambia, sasa ukienda huko, wewe si msichana sasa. As far as you are pregnant, you are mother. So naambia, mama, tembea. Nikatembea. So my sister-in-law akaniletea vitu zenye zinahitajika hospitali, of course. Akaniletea, so niko hapo by saa 9 asubuhi. That is when now pain came. What is called pain, eh? So I went through all that. Nikatembea, nikajikaza. By 9 in the morning, that is when I delivered my beautiful girl, of course. Yes. Then after that, I was admitted. You know, nikaadmitiwa that I remember very well, it was on Monday. Nikalala Monday, Tuesday evening. Ndio niliambiwa nitadischargiwa. And at that time, mtoto hajapata BCG. So I was like, daktari, sinilale basi mdunge kesho. He was like, no, madam. Sasa unataka udunge kitoka wapi? No, hakuna. So I'm like, naenda nyumbani na mtoto na hajadungwa. And there is a reason as to why watoto wao wanadungwa at birth. So naenda naye nyumbani nikamfanyia nini, you know. So akaniambia, what you do, just go home and zikikuja you will know, then you will come. So I was like, na sasa obvious ukienda nyumbani kwa na mtoto, kuna watu watakuja kushika mtoto. You don't know huyo mtu ako aje. Je, ako na shida gani, ako na TB ama ako na nini. So na uwezi nyima mtu mtoto. Unaona? So sikuwa na otherwise. I had to leave. So mimi nikachukua vitu zangu, mtoto wangu, kaenda nyumbani. That was on Tuesday. Nikakaa nyumbani Wednesday. Thursday nikasikia hapana. No. Sisi kana mtoto kama hajapewa BCG. Nikaenda to the nearest facility, that is level 2. And remember, nimejifungua on Monday. Na ninapanda pikipiki. You know? Pikipiki na nilijifungua on Monday. Thursday niko kwa pikipiki tena. Na mtoto ako na days. Na hiyo baridi ya pikipiki. I went to the nearest facility. Nikapata daktari, nikamuuliza daktari, hivi vaccines zimefika? She was like, no, bado hazijafika. So I'm like, daktari, nitarudi nyumbani tena na mtoto akiwa hivi. Si mgonjwa lakini anafaa apewe hiyo BCG. You know what she said? Kwa hivyo nataka nifanye aje sasa? Kaambia sawa. I went back home. Nikakaa Friday, Saturday, Monday. Sunday, Monday nilikuwa tena kwa pikipiki. Nataka tu ni insist at least. Nikaenda kwa hiyo level 2 tena. Anauliza, "Mama umerudi tena?" Nikamwambia daktari nimerudi. Niambia tutafanya aje? Tutasolve hiki kitu aje? Niambia sasa nasikia zimekuja lakini hazijafika huku level 2. Maybe uende Mwala level 4. Kwa pikipiki tena. Na niko na 1 week kama nimejifungua. Kwa pikipiki na mtoto Mwala tena. Nikaenda Mwala, that was on Monday. Mwala wakaniambia huwa tunapewa watoto BCG on Wednesday. Nikakuuliza, na vile kwetu nimetoka mbali, nitarudi tena? Aki please. Nipeni tu mtoto BCG tafadhali. Kaniambia no. Until Wednesday kwa sababu ndio mama huwa wanakuja karibu wote, wanakuja wengi, tunadunga at the same time. So mimi nikawaambia hakuna otherwise, let me go. So kufika hapo soko nikafikiria niende nyumbani na mtoto ama nifanye aje. Nikasema let me go to Masi kwa gari. Nikaenda Masi. Kufika Masi nikakaa hapo tu, mama wanakaa wakingoja. Nikaenda nikauliza nataka BCG naweza pata. Daktari kaniambia watu tunadunga kesho, Thursday. Nikauliza nitarudi tena huko kwetu tena. And remember sasa ni jioni. Because nitoka nyumbani asubuhi nikapitia level 2, nikaenda tena Mwala mimi huyo Masi. Kaniambia hakuna otherwise. And you know, okay, not in a bad way, but unajua daktari wanakuanga ever busy. So wakikwambia jibu hii, if they answer you, hawana time ya kushinda wakikujibu. So hakuna otherwise. Nikarudi tena. I remember that I'm using money. Na hizo niko na 1 week, mtoto wako 1 week na baridi ya pikipiki and whatever. So kwa gari tena, kwa pikipiki tena mpaka nyumbani. That is on Monday. Because Mwala waliniambia wao wanapeana BCG on Wednesday. That Wednesday I was very sick. Unaona, ile baridi, umeshinda ukizunguka, uko na mtoto, uko na 1 week after kujifungua. So siku manage. So hiyo Wednesday sikuenda. Thursday hiyo level 2 yenye kwa karibu waliniambia wanadunga on Thursday pia kama Masi. So kuenda hapo nikapata daktari hayuko. Nikaenda sikupitia Mwala kwa sababu hapo sasa sikutaka niharibu time. Nikafika tu Mwala stage, nikachukua gari Masi. Kwenda kufika hospitali Masi hivi. Daktari namuuliza na hakusahau na mimi. Umerudi? Nikamwambia yes, I'm back. Kaniambia una bahati. Ati why? Ati huwa tunadunga ati chupa moja ati watoto sijui wawili. It is shared. Na sasa hakuna mama mwingine hapa. Na hatuwezi fungua hiyo chupa. Hatuwezi fungua hiyo chupa. So what will I do? Sasa hebu kaa uone kama kuna mama mwingine atakuja. I was very patient. Nikakaa hoping that kuna mama mwingine atakuja. So nikakaa, ikafika saa 10 jioni. They want to leave. Masaa yao ya kazi imeisha. So I went back home. Mtoto wa karibu kumaliza hata 2 weeks. Watu wanakuja nyumbani. People are travel the way from when ngine atoka Mombasa. Mtu hawezi toka Mombasa akuje kushika mtoto na umunyime. Hata kama unajua ako na TB huwezi mwambia wewe. Unajua unakuwa na TB wewe? Nilisikia unakuwa na TB. Vile unakoa wewe. Huwezi shika mtoto wangu. Na ametoka all the way from Mombasa. So hiyo kitu nilikuwa nasikia inanisumbua. Unaona? So nikarudi tena nyumbani. Kurudi nyumbani, nikakaa, that was on Thursday, nikakaa Fridays, Saturdays, I was almost giving up. But sitaki kugive up kwa sababu ya mtoto. Nikauliza, is there any hope? Akaniambia, you are very lucky. At least today, you are very lucky. Nikapata mama mwingine hapo. Na huyo, mimi niko at least, niko na 2 weeks. Kuna mwingine hapo, alikuwanga na month plus. Mtoto hajapata BCG. Then at least finally mtoto akapewa BCG. At least sasa nikasikia roho imetulia.
Ningependa kujua after the BCG incident zile vaccines zingine ulipata tu vile inafaa?
Yeah.
Okay. But you know I'm a public health officer and hata nasikia kuficha uso because first I must admit that honestly, I admire your resilience. And again, however, I'd like to understand why such a thing would happen, yet we have an institution that has been given the mandate to protect and to take care of its people. Why would that happen? Now, let's get to such a serious and a very sensitive topic, and that's on finances and financing, right? Now, we'd like to know how the relationship between the Kenyan government and Gavi. Gavi is Global Alliance for Vaccination and Immunization. So, David, please give us an overview.
Thank you. First of all, I'm really moved by what she's just shared. I don't think anyone, any mother or any person should go through this just to acquire life-saving vaccines. They should be there, they should be provided, and it would be important for us to just look at what you've said, actually, the policy that exists between the Kenyan government and Gavi and how they've been supporting Kenya's immunization program for a while now, even as they transition out. So I think it's essential to maybe just understand what it is. So we have a policy with Gavi that requires us as Kenya to gradually increase our financial contributions towards vaccine procurement as the economy grows. So this approach aims to provide each country with its own sustainable immunization program, because as the years go, you keep increasing the funds and Gavi keeps reducing their contribution towards your immunization program as a country. So I think to explain it in the Kenyan context and what is currently going on is that our gross national income, that's our GNI, per capita has exceeded Gavi's eligibility threshold. So what does that mean? Tulitoka from a second-class country, from a third-class country to a lower middle-income country. So with that, it means that Gavi can no longer keep supporting us. Gavi and other donors can no longer keep supporting us. So originally, they were supposed to leave the country by I think 2025 or 2027, and I think that's still the plan. So by the time that we're getting to that transition phase, we need to be fully supporting our immunization program, which we currently are trying to. I cannot say that the government is not doing things, because they are very responsive to the vaccine stockouts that happened last year. There's a current vaccine stockout ongoing, in some areas of the country. So this should not be a situation that is there, and we continue to call upon the government to meet its obligation for this year, which stands at around 1.25 billion. So yes, actually the interesting thing is that immunization is still 0.1 to 1% of the total health budget of the country. So it's not really a big figure, and I think that it is important for us to continue emphasizing and pushing our government to meet that particular obligation so that we avoid such situations. Yeah.
Could it have contributed maybe to some of the vaccine stockout?
Definitely, because I know that USAID and Gavi do partner closely and they do work together. So yes, that is a gap, but I think that's a gap on a more international level that shouldn't really come and affect Kenya, because Gavi has not pulled its funding, nor have they reduced their funding. They are consistently meeting their obligations. The only caveat is that they will not release funds unless you as a country have released your obligation, so that they can facilitate what the balance is and you can proceed to procure vaccines. We have seen this issue affect us severally in the past years, and we have seen that the government has been called upon to do budgetary assessments and try and find finances to cover gaps as the year progresses. But I think this can be avoided if at the beginning of the obligation period, which is, the deadline is June 30th, if they can meet the obligation by then we avoid this situation that she has faced and other parents, I'm sure, are facing out there.
Okay, so as HENET, what are you doing towards the same?
As HENET, we have leveraged our membership to try and provide information. So for example, this particular ongoing stockout, it hasn't reached widespread counties, but it has reached counties. So we know this because of the partnerships and the membership that we have. So we continue to leverage on our relationships that we have, even with the government. We work closely with the Ministry of Health and other government institutions around health to just provide information, real-time information to citizens about what is happening, and we continue to advocate for their rights to health, and we continue to push the accountable persons to meet their end of the bargain, because the government has committed to several things. It's not just immunization. Today it is immunization that we are discussing, but they also have other obligations in regards to family planning, in regards to climate, in regards to commitment to nutrition. So yes, HENET continues to support, push and collaborate, build on the partnerships that we have to just provide a voice for health NGOs and the Kenyan citizens to relevant stakeholders, just to make sure that their health needs are met.
Oh wow. And by the Finance Bill 2025.
Yes, nimesikia tunarudi street.
Is out, but it's not yet released, and let me tell you, it's tough. Yes, we are very ready, very ready. We have our pens and paper. We must take notes, and we must fight for our country, because if we don't do it, who else will? No one. So yeah, now that the government has a part to play, also we as a people, as a community, we have a part to contribute in all this. So Mercy, could you please explain to us the role of the community towards immunization?
Thank you so much for that question, Shirley. And first I want to commend my colleague here. That was a powerful story, and clearly it has brought out what part of what the community can do. I think the most important thing is responsibility starts with an individual, because community ni sisi tunaishi pamoja. It starts from an individual, then it spreads to the community. So one role is just making sure that there is increased knowledge at the community level. We just make sure we leverage on things like, I know since health got devolved, kuna hizo zinaitwaje units at they start at the county level, sub-county, and then now we have the community health units that are run under the community health assistant at the health facilities. Doesn't matter, like that is the health unit led by a chairman or chair lady is the smallest health level that we have. So it's just calling upon the government, we as a community, to be able even to leverage on CHPs. We have community health promoters that have at least 100 households. Wanna leverage on CHPs, and they can be able to just capacity build them and capacity strengthen them with information on immunization, because I'm sure kama ungekuwa na information ya the importance of immunization, haungepeleka mtoto kwa facility. So while they're even doing the other things kama collect data, the CHPs, collect data, kupeana aquatabs, saisi kuna cholera wanapeana aquatabs, and those things, they just also give information on immunization kwa community level. Also another thing, ile time chief anatuita kwa baraza, the communities, we can always make sure the chief gives us information on immunization, the importance. Ama kukuwe na public, I have seen like what works for us uko Eastlands. Kukiwa na community baraza, chief anaita public health officers, wanapeana update on things. So wakipeana hata update on maybe what is affecting the community, wana insist like people go to the clinic to get to take their children for immunization. And then also as a community, especially representing young women, I know kuna age 10 years, the young girls are supposed just before they become so reproductive, they're supposed to be vaccinated the HPV vaccine. It's just a matter of us as a community also increasing the knowledge, the importance to demystify hizo myths and misconceptions on HPV at the community level. Utasikia watu wakisema, hey, you want our children to become barren, unajua tu kwa kijiji mambo ikianza vile inaendanga. So just demystifying those myths and misconception and telling them the importance of getting immunized on the HPV vaccine. And also another important part is also making sure like for those who uptake kuna hizo vaccines family planning, just consistently insisting like these things are available at the health facilities. And also I would like to thank HENET sana kwa sababu they have really invested in the communities, just explaining to them the importance of PHC, ile facility fund. There's something like that. So currently, na hiyo fund, the facility is able to cater the government facilities and dispensaries to cater for like whatever is needed in the facility. So hakutakuwa na stock out. So hizo vaccines, either ni family planning, either ni the BCG, either ni the HPV, any kind of vaccine that we need, the facility itakuwa it's catered for. And then I think it's also our role tunaenda public participation. Sasa tuko karibu kwenda public participation. Tunaenda tunapeana tuna advocate. We just read through and like the documents and see the allocation towards immunization. Then we can go with our facts. And we have organizations like Kenneth here who can be able to support us community members to be able to write good memos that you can present so that the government continuously advocates for more allocation or more budget allocation towards immunization. Unajua, we are, just like David said, we are on a journey to self-reliance, which is supposed to, all donors, majority will have exited by 2027. So that is our mandate, just to be able to make sure we hold our governments from the national to the county level. Through what? Public participation. Si lazima tuende streets. Lakini ukienda uko public participation, tuone imeshindikana, maybe tunaweza ingia streets, but because now they hear, if you present memos and facts of what is happening in the community, they are going to definitely increase the budgets on immunization. And the last thing, leveraging on social media, for the young people out there. Yeah, it's very crucial just to be able to educate our fellow other youths, because unajua, people, when we speak about immunization, people think ni BCG tu na zile za watoto, that ka age. Immunization iko nyingi. Kuna ile tetanus, ukidungwa na kitu huko nje, si you will need tetanus, ndio. For the young girls, kuna the HPV vaccines. For the reproductive girls on reproductive age, they will need the contraceptives that are vaccines. So it's among us just to educate ourselves on the immunization that suits our age group and even our communities, and to be able to cascade to our peers through social media. Tukifanya kwa kijiji, pia kwa social media tunafanya. And just as I finish, it all begins begin na mimi, like, if it is to be, it is up to me. So let us leverage on ourselves. While I educate myself, also the community will become healthier through immunization.
Thank you. Nice. You've mentioned about myths. Is there any myth you'd like to demystify here today?
Yeah, hiyo ya HPV, I just want to demystify that. The HPV vaccine, it's given to young girls. Okay, in the community, the myth is like this. Mnatudungia watoto shindano, ndio wakue barren, they cannot give birth. But no, this vaccine is given to girls who are 10 years. They're just about to begin their reproductive age. And it helps prevent cancer, cervical cancer. And and hepatitis. So it's very important. It's not hiyo vaccine ikuangia make the girls barren. No, it's just preventing you from cervical cancer and even the hepatitis at an early age, which is very crucial. And it's good because the government has allocated funds towards it. They could have wanted to give the whole community, but they've at least we are moving towards the preventive. Tumetoka kutoka curative, tumekuja preventive. So that's one myth I would like to demystify, that the HPV vaccine is not for making young women get barren, young girls, adolescent girls and young women. It's just basically to prevent them from cervical cancer and hepatitis. Yeah,
I think maybe I can build on that. There are two things that we witnessed last year. Hennet supported, of course, as she said, development of several memos, but also we supported the ministry itself and the different counties in implementing immunization programs, like the polio campaign that took place late last year. Yes, it was for specific targeted areas with low indicators. So those were mostly places with, they're not immigrants per se, but the Somali community, so Isini, South Sea, such areas. And there were myths about the quality of the vaccine that they get. So they believe that if they go to a private institution where their doctors are, so I put their doctors in quotes, meaning maybe the Muslim community, because they have specific hospitals, say in Nairobi South. You'll hear that they've gone to Nairobi South because they trust this specific doctor and they trust the quality of the vaccine that they get. But I think that should be addressed because every place that you go that you can get a vaccine from, they come from the government. All of them come from the government. There's one particular distributor and there's one particular acquirer of vaccines, and that's the government. That cannot be taken up. And all vaccines that are taken to these different private institutions, private health facilities, public health facilities, local health facilities, all of them come from the government. So I think also community engagement would be very important, because during that campaign, their indicators went up to around 91% of coverage, and that's because we were able to work closely with the immunization lead in Nairobi County together with a chief from the area who understands the cultural context and was able to really explain to his constituents what it is that the importance of the immunization, where these vaccines come from, and it culminated in a drive which was successful. So I think information and leveraging on community engagement, as she said, is very important to control the narrative in regards to myths and misconceptions on immunization.
All right, David, now that you're a man, I'm just interested to know, have you ever taken a child or a sibling for vaccination?
I have, yes, I have taken siblings, and I had the opportunity to also take a child for vaccination. So I have seen the Purple Book, at least see stories at Jamba. It actually exists. So yes, I have. Yes.
How was the experience?
I think I was fortunate enough to go to a facility that was more accountable, per se. I'm giving them their flowers. This is Plainsview Hospital in Ruiru. Yes, I think every time that we went there, the book was filled up as it was supposed to be filled up. We were given guidance on when next to come for the next vaccines, why we are taking these particular vaccines. There was some sort of order in what was being done. So yes, I have generally had a better experience with vaccines. But again, this was under a different government. I think 5 years ago. 4 years ago, yes.
Okay, so what can you say is the role of men in immunization?
I think that's actually an interesting question. We live in a changing but patriarchal society where matters child health has been relegated to mother's responsibility, and I think that's a narrative that needs to change, because you can see how that affects men as they grow. Our health-seeking behaviors are terrible. I'm telling you, if people were getting to an age where you are aware of yourself and then you go acquire vaccines, a lot of men would die. We would not go for those vaccines because, one, we would not know where to go, and number two, we would not see the importance. Yeah, so as men, I think it is a matter of changing the narrative, changing how things have been done, and taking more initiative and interest in your health and the health of those under you. Yes.
What would you tell fellow women, like young mothers?
What I can tell young mothers is kwanza jikubali, don't fear, mtoto ni baraka, and if you are a young mother out there, be there for your kid. If you found out that you are pregnant, enda clinic, usiogope. Unajua kuna watu wanaficha mimba. Mtu anavaa jacket inatoshana blanket. Be proud of that. Usiogope anything. attend all the clinics, you know. If it is mambo ya vaccines, be there for your kid, you know. Yeah.
Na kwa nini ulianza clinic na 4 months?
I was so scared. Nasikianga the myths, you know. Unateteshwa, ukienda hospitali utateteshwa. So I was like, mimi niko na mood zangu, alafu daktari aniteteshe. Kumbe that one was a myth. Ukienda ko, they are just good. Like, even though waliniuliza, where were you?
Juu nilidhani actually ukienda na 4 months ndio utateteshwa zaidi.
Huyo hakunitetesha. Kama aliniangalia akaona huyu ni mdogo, hebu na nimuhurumie. So she was nice to me, you know. Yeah, I was scared. That's why I've said, young mothers, don't be scared. When you find out that you are pregnant, even if it is 1 month, even if it is 2 weeks, go to hospital. It's very, very important. Mtoto ni baraka. You know, be proud of that. Yeah. I wish I knew that earlier, you know. I wish I knew that earlier.
This is the decade.
Yeah. So I wish I knew that earlier. I was so scared, you know. Unaficha mimba ya nini? Unavaa trouser, unakaza. No, don't do that. Yeah, be proud of that. Usiogope.
Wow, that's really nice and very powerful. Hata mimi I am motivated. God of nyota iendelee kuwaka. So, Mercy, could you please help us identify the gaps that exist in awareness creation in our communities?
Finding a way of attacking those myths and misconceptions is very crucial in these times. I'm also feeling like when information is being dispersed in the community, I pity the right people. Perhaps you should start with gatekeepers. When I talk about gatekeepers, yeah. Kama ni sheikh wa kanisa, sheikh wa mosque, pastor wa kanisa, chief, nani, and make them champions of information on maybe information on immunization. Then that way they are going to cascade this information to the community because they understand the cultures, the people of that community. And also other things, I think something that makes people not access immunization easily is hivyo tu vile my colleague has said, unaogopa kwenda kuteteshwa kwa hospitali. Like, why have you started your clinic late?
It's usually that bad.
Yeah, because I feel like the hospitals also do not have enough human resource. I want enough human resource. So if it's a nurse or a clinician who is in the child department, ni moja na kuna HR human wanaitwaje kuandika records the records health records person ni moja, and the women they are serving is more than 80. You see, there's a lot of burning out. So that is one call to the government. Maybe they should just employ more human resource and also teach these healthcare providers just to be very friendly to
the teachers.
Yeah. Okay, I know. Lakini pia naelewa kuna burnout kwa sababu ya a lot of the workload but then just take them for a debrief and also capacity strengthen them on just be friendly, be a friendly healthcare provider to these women, because also they are just from childbirth. The ones who are coming for BCG, the ones who are coming for child clinic, maybe you're a first time mother, wewe hujaipitia hizi vitu, mtoto anakusumbua tumbo nini. Yeah, and also maybe when it comes to, I love the way like now we are adapting in Nairobi County when it comes to things like the polio campaigns. At least there is a coordination, there is a very coordinated mechanism from the county, sub-county level to the CHPs, and they're able to create awareness in the community at an early level. We're going to be having this campaign, and everybody, the importance of that campaign. Just the important thing is us just leveraging on ways, hata kukiwa na hizo, for example, where I come from, there are those football tournaments or stories are based. There are young fathers there, there are young mothers there. Just touch on, like every time you're somewhere, like there are people and there are young children, touch on matters on immunization, and just remind them that their health is very important. And I just want to echo what David said on matters of the role of fathers. I just want to give kudos to one health facility. It's a government health facility, a Nature Dandora 2 health facility. I just want to give kudos to those nurses in the NC clinic, because when the dad comes with the mom, yani mama anakuja na bwana yake, either it's ANC or after umezaa mtoto, they will always give that man a priority with the mother, because wanna feel where this is effort. Unajua convincing a man to ende hospitali to testiwe HIV, already it's a process to testiwe syphilis, tujue mimba iko miezi ngapi. Yeah, so they have created a very friendly environment where even young fathers can be able to bring their young wives to be able to access ANC easily. Yeah.
All right. So David, could you please touch on last year's polio campaign? What did you achieve? What were the challenges and all that?
Okay. I think it was specific to the areas I had highlighted earlier, which had low indicators, and what stood out with those two areas is that they had a lot of immigrants settling into those areas. So there was a lot of vaccine hesitancy and just their general attitudes towards the quality of the vaccines that are available to them through our public hospitals or the public health facilities that they have around those areas was very low. So what was done basically was we partnered with the chief, a sheikh from Sauti, the main mosque in Sauti, and the Nairobi County Immunization team, led by Lillian. She was instrumental in just us reaching to that particularly affected area, and it was a more door-to-door sort of campaign, but it began with us going to these mosques and leveraging the platforms that they already had. So this was the main mosque and in South Sea. So when they were having that Friday worship, I think that's usually their main worship, the information was actually shared out that there will be drives at that mosque, because they recommended we do it at a place where they feel a bit safer, and our mosque stood out. So yes, we leveraged the places where they are comfortable congregating, engaged with that community specific need to hear the challenges. They have challenges even trusting each other. For those who are born in Kenya, the other Somali who come to the country think that they have been corrupted. So for them to get any services through them, it's a very big challenge. So it was an intense 2 weeks of effort and work with the county to just try and change that perception as we were going towards the day that we would actually do the drive for the vaccines. And on the actual day of the vaccines, there was actually great turn-up, which has the 90% that I told you. It was, I think, 91% coverage from a very low indicator. I can't remember the original indicator, but it was very low. So yes.
Nice. So Kate, ukiweza pewa opportunity, you talk to the government directly. After all that, utawaambia nini?
To the government, what I can say is, hizo vaccines zikuange hapo. Mimi kutembea nilitembea hapana. No.
Tutatenga.
No. That one was too much.
Yeah.
That one was too much.
It is.
Hizo vaccines kusikuwa na shortage, ati hakuna vaccine. Tena hiyo ni at birth. So let them be there. Maybe tetanus. Yeah. Yeah. So what I can say to that question, or to the one you've asked, government, vaccines zikue 2 weeks. No. Unajua naongea nakumbuka ni kama jana. You know what I was going through. Yenye naniuma 2 days kwa barabara. And I'm supposed to be relaxing.
Yeah.
You know, I'm supposed to be
baby girl.
Nafaa nikuwa hapo nyumbani. Yote mnafaa kuwa naambiwa amka kunywe uji, you know. Yeah, unasikia unataka nini saa hii, sijui nini. But that time kwa barabara, vumbi imejaa kwa kichwa. Naenda unapata hakuna. Haki. Hizo vaccine haki.
Yeah.
Ikifika mambo ya health, haki please. kwanza sana watoto, vaccine is supposed to be there. Please.
Government prioritize health. Hiyo tumeomba. Mtusikize. And again, tukikuja kwa streets, I just karibu niongele mambo ya treason as criminals. Nikaona tutaleta siasa hapa. So as we wind up, please say something, just a parting shot. Address it to anyone. Tuanze na nani? David ama hivi.
So my parting shot is just maybe to the government, leverage on technology. Ndio hii vaccines za watoto sana zikwe. It doesn't have to be a specific day kwa health facilities like BCG is given. Let us just leverage on kuna very new technologies zimetokea hata za kustore the vaccines. So we're leveraging on new technologies just to be able to make sure like the community is covered on matters immunization. And so my parting shot is your health, my health is my well-being. So let me take as a young woman and even as young people out there, take responsibility of your health. Make sure you've gotten all the immunization that you're supposed to get. Do not ignore, like always keep yourself informed. I said again, if it is to be, it is up to me. Take responsibility of your health. Thank you.
Okay, to me is first to young mothers, as I've said, usiogope. Unaona, don't fear. Ukikuja ukipata hii mambo imefanyika, mambo ni mawili tu. Hata ikifika mambo ya mimba, jambo ni moja. Yes. Jambo ni moja, unabeba mimba, unajifungua. Sawa. So
Nasema tusiende Mary Stops.
Mary Stops, no. Kama mambo imetendeka, ni hivyo. So to young mothers, be proud of that kid that you are carrying. Na usiogope kwenda clinic, enda hapo. Unajua akikutetesha, lakini hawezi kutetesha. Unajua mimi akanisi itisamii.
Mine is twofold. One to men. We should, of course, take more initiative and more interest in matters health, our own health, and that of our little ones and our family. And then the second one, and more importantly, to the government, to honor its current obligation. We do acknowledge, and I do acknowledge that they have done a lot in regards to our immunization program, but there's still a lot yet to be done, and already we are running out of time this year. We're already going through stockouts, and we aren't even at June 30th. So it's just a call and a request that they honor their current obligation as it is, so that we avoid the situations that we had last year in such situations.
Wow, such a powerful and an impactful discussion. Thank you so much for heeding to our call. And thank you for your very powerful insights. We look forward to having more and more of this. And to our people, thank you so much for sticking with us to the end. Until the next one, bye.